Hello everyone, I am Dr. Madhura Muley. I am Assistant Professor in the Department of Anatomy, MGM Medical College and Hospital, Aurangabad. Today we are going to see the cervical vertebra. Out of the 33 vertebrae in the human beings, the 7 are the cervical vertebrae. The 7 cervical vertebrae we can see over here. This is the first cervical vertebra, which is also called as atlas. This is the second cervical vertebra, which is also called as axis. This is the third, this is fourth, this is fifth, and this is the sixth cervical vertebra. And this one is the seventh cervical vertebra. Out of these all 7 cervical vertebrae, the third, fourth, fifth, and the sixth, these cervical vertebra, they share the common specific features, and that's why they are classified into the typical cervical vertebrae. But the first, second, and the seventh, they have their own characteristic identification points, and that's why they are classified into the atypical cervical vertebrae. So out of the 7 cervical vertebrae, first, second, and seventh, they are atypical cervical vertebrae, while third to sixth, they are called as typical cervical vertebrae. So in the today's topic, we are going to see the typical cervical vertebrae. We'll continue with the typical cervical vertebra. This typical cervical vertebra, as any other vertebra, it has the body and the 2 neural arches, the right neural arch and the left neural arch, the transverse processes and spinous process. Now, to identify the cervical vertebra, the important feature for identification of the cervical vertebra is having a foramen transversorium in the transverse process. So this is the foramen transversorium affecting each of the transverse process of every cervical vertebrae. So this is the identification point for the cervical vertebrae. The body of the cervical vertebra, they are transversely oval and they are smaller as compared to the vertebral foramen. This transversely oval superior surface, it shows a raised lips on either side, and these lips, they are called as uncal processes. On inferior surface of the body, it shows a reciprocally opposite surfaces, that is transversely it is convex, while anteroposteriorly it is concave as that of the saddle shape to fit into the respective adjacent vertebrae. So this is the inferior surface and this is the superior surface, so it gets fit with each other because of the reciprocal surfaces. So body on the superior surfaces, they are raised on either side. These raised processes, they are called as uncal processes. These uncal processes, they form an additional joint with the adjacent cervical vertebrae, and these are called as uncovertebral joint, or they are also named as joint of Leshka. These are synovial type of joint. So overall in the body we have the 3 joints, one as every vertebra, that is between the intervertebral disc, which is secondary cartilaginous joint, and on either side with the uncal processes we have the uncovertebral joint, which is also called a joint of Leshka. The neural arch, which includes the pedicels and laminae. The pedicels, they are the plate of the bones which run backwards and laterally from the posterior surface of the body of the cervical vertebrae. These pedicels, they are attached at the midway between upper margin and lower margin of the body, so that the superior vertebral notch and inferior vertebral notches, they are of equally deep. The lamina, they run, these are the thin plates of bone, they run down backwards and medially, and they meet with each other at the spinous processes. These lamina, they are very thin in the cervical vertebrae. These are the spinous processes. These are short, transversely present and characteristically bifid in cervical vertebrae. So this is another specific point about the typical cervical vertebrae, that the spinous processes, they are bifid and they are short. Then at the junction of pedicel and lamina, we have the 2 articular processes, superior articular process and inferior articular process. These superior and inferior articular processes, they have a facet which articulate with the respective vertebrae, adjacent vertebrae. This facet on the superior articular process, it is flat and it is directed backwards and upward, while the inferior articular facet, it is directing downwards. So this is directing downwards and forwards to get attached with the adjacent vertebrae. So here you can see this is the inferior articular facet and this is the superior articular facet. So inferior articular facet, it is directed downwards and forward, while the superior articular facet, it is directed reciprocally upwards and backward. Both the facets, they are flat. The transverse process of cervical vertebra, it has an identification point which is called as a foramen transversorium, affecting all the transverse processes. Anterior to this foramen transversorium, we have, this is called as anterior root. Then we have, this is the anterior tubercle. Posterior to the foramen transversorium, we have the posterior root, and at the end of the posterior root, we have posterior tubercle. Now, both the tubercles, anterior tubercle and posterior tubercle, they are joined with each other by a plate of bone which is called as costo-transverse bar. So we'll revise once again. This is the transverse process which has foramen transversorium. Anterior to the foramen transversorium, we have anterior root. Posterior to the foramen transversorium, we have posterior root. On either end of the root, we have, this is the anterior tubercle and this is the posterior tubercle. Now in the cervical vertebrae, the costal element, it is formed by the anterior root, anterior tubercle, costo-transverse bar and posterior tubercle. These all things together form the costal elements, while the transverse element in the cervical vertebrae, it is alone formed by the posterior root. So posterior root is the true transverse element, and that's why the anterior root, it is attached to the body of the cervical vertebra anterior to the superior vertebral notch, while the posterior root, which is the true transverse element, it is attached to the neural arch at the junction of pedicel and laminae. So this is in short about the specific points about cervical vertebra. Now we are going to see the attachments on the cervical vertebra. The ligaments which are attached, which is common for all the vertebrae, they are anterior longitudinal ligament, which is attached to the upper and lower margins of anterior surface of the body. The posterior longitudinal ligament, which is attached to the upper and lower margins of posterior surface of the body. The ligamentum flava, which is fibroelastic ligament, which is attached to the adjacent lamina. These are the common ligaments along with the interspinous ligament, which is attached to the spinous process. These ligaments, they are common for all the vertebrae. Now, this is the anterior tubercle. This anterior tubercle, it gives attachment to the three muscles. They are longus colli, longus capitis and scalenus anterior muscle, while the posterior tubercle, it gives attachment to the scalenus medius, scalenus posterior and levator scapulae muscle, along with the other few muscles. Now, this spinous process between the bifid spine, this area gives attachment to the important ligament, which is called as ligamentum nuchae, which is very specific for the cervical vertebrae only. So bifid spine, between the bifid spine, we have the attachment of ligamentum nuchae. This is the vertebral foramen. This vertebral foramen, it is triangular and it is larger as compared to the transverse vertebra because it has to accommodate the cervical enlargement of the spinal cord. So content of this vertebral foramen is spinal cord, a cervical enlargement of the spinal cord, along with the three meninges which covers the spinal cord, that is dura mater, arachnoid mater and pia mater. Now this foramen transversorium of each of the typical cervical vertebra, it consists of the second part of the vertebral artery, vertebral veins and sympathetic plexus of nerves around the vertebral artery. Superior vertebral notch, it consists of, or they passes the respective roots. First spinal cervical nerve, it passes between the first cervical vertebra and skull bones. Second one, now it is present between the first and the second cervical vertebra. So every cervical spinal nerve, it passes above the respective cervical vertebrae. But now, as we have an additional cervical spinal nerve, that is C8, So the C8 spinal nerve, it passes beneath the 7th cervical vertebra, and now onwards every spinal nerve, it passes beneath each respective vertebrae. The spinal nerve immediately divide into its ventral primary rami and dorsal primary rami. So ventral primary rami of spinal nerve, it passes over the costo-transverse bar. So this specific concave groove on sites of articular processes, they are for the dorsal primary rami of respective spinal nerve. Anterior tubercles in C3, C4 and C5, they are more medial as compared to the posterior tubercles. But in C6 cervical vertebrae, this anterior tubercle, it is more in line with the posterior tubercle and it is larger. So that's why it is called as carotid tubercle. Now the importance of this carotid tubercle is that we can palpate the common carotid artery at this common carotid tubercle of the C6 vertebrae. The another important point about this carotid tubercle is that this carotid tubercle, it also separates the common carotid artery which is present anterior to it and vertebral artery which is present posterior to it. Also we can use this palpation point carotid tubercle for giving the brachial plexus block or cervical block in the anesthesia. Oncovertebral joints of the body of the cervical vertebra, they are the common site for the formation of osteophytes. These osteophytes then compress the root of the spinal nerve which is present behind them. So when they compress on the respective spinal nerve roots, the patient will complain of pain and numbness along the side of that spinal nerve. The disc prolapse, it is more common at the level of C4, C5 or C5, C6 level. Usually the prolapse disc protrudes posterolaterally and again compresses the spinal nerve root. If these osteophytes of oncovertebral joint, if they are formed along the lateral side, they can compress over the vertebral artery which are running upwards lateral to this joint. So this is in short about the applied of cervical vertebrae. So in the conclusion, we have seen that cervical vertebrae can be identified by the presence of foramen transversorium in the transverse processes of every cervical vertebrae. So whether it is atypical or typical cervical vertebra, every cervical vertebra, it is going to have the foramen transversorium in their respective transverse processes. So this becomes the identification point for every cervical vertebrae. So along with the presence of foramen transversorium, every typical cervical vertebra, it is going to have bifid spinous processes and a large triangular vertebral foramen which is larger as compared to the body, and transversely present short body of the cervical vertebrae. These are the identification points for the typical cervical vertebrae. So we will stop here. Thank you so much.